Okay, so today we are here with Dr. Goyle of Integrated Spine Pain and Wellness, and he's going to tell us a little bit about chronic pain. He's going to explain, for people who aren't familiar with chronic pain, just really what it is and what are some of the symptoms you can look for, and how do you differentiate between chronic pain and just your everyday, aches and pains. So, Dr. Goyle, could you explain to us what exactly is chronic pain?
Sure. So, chronic pain is any pain that lasts beyond 3 to 6 months. So normally when people have injuries, you'll feel pain. That's your body telling you that something is wrong, right? It brings your attention to that area so you can focus on whatever the offending agent is and ideally remove it so your body can heal itself. Well, when that pain persists 3 to 6 months, there is a rewiring that happens in our bodies. So our nervous system, our brain, they start to recognize this pain pattern as normal. And so pain can extend beyond those 3 to 6 months. So that is technically what chronic pain is. Chronic pain affects tens of millions of Americans. And it's the number one reason why patients call their physician or go to the hospital or go see their doctor. When you were talking about normal aches and pains, right? So, for example, if you're a weekend warrior, you play golf, your back hurts, ideally that should go away, within a day or two, typically. But if it doesn't and you notice that, hey, this pain is lasting for weeks on end and it's interfering with my quality of life, that's when it really becomes a medical issue. So it comes down to quality of life with a lot of this, right? So pain distracts you from who you are. That's one of the reasons why I chose pain management, is to help people return to who they are.
Absolutely.
So,
yeah. Now, I noticed with your credentials that you are a specialist in acute and chronic pain. Can you tell us what is the difference between acute and chronic?
So acute pain is pain that happens right away, usually due to trauma or some kind of injury. And then chronic pain is when that pain persists beyond the normal healing time. So for example, if someone breaks their ankle, we expect that pain to go away within a few weeks. So, maybe a couple of months at most. But when the bone is healed and the pain persists beyond the healing process, the healing time frame, that's when it becomes chronic. And that's,
So what would be some examples of the acute pain, and why would somebody with acute pain, what are some symptoms that they would need to look out for to basically tell them that they need to come and see you?
Perfect question. So I'll give you an example. This is probably one of the most common reasons people have acute pain. They'll herniate a disc. Everyone's heard of a slip disc in their back. So the disc will come out of place for whatever reason, lifting weights, lifting something, repetitive activity. The disc herniates and hits the sciatic nerve. And it causes nerve pain down the leg. Normally, patients will either try to change whatever activity they're doing to see if they get relief, rest, over-the-counter anti-inflammatories, medications. And if that doesn't help, then they'll usually pick up the phone and call and say, hey, look, I've got this issue. So, but the big red flags are numbness, tingling, and weakness. Those are things that you really want to make sure you get immediate medical attention for. Because that's a sign that there is a nerve injury occurring.
Now, if a patient calls to make an appointment, what is the process like as far as when they come in and see you? Tell me and tell people watching what that process looks like and what they'll experience when they step into your office.
So the process typically involves either a patient calling the office directly and saying, I have so-and-so pain complaint and I'd like to see Dr. Goyle for an evaluation, or patients will get a referral from a primary care physician or a neurosurgeon for whatever it is that's ailing them. So they come to the office, they have a lot of paperwork to do. That's
the dreaded paperwork.
That's the unfortunate part of the visit. But then I'll meet with them in the consult room and I'll take their history. So typically I'll ask them, this is my way, what's going on? What brings you here? And tell me your story. And then, of course, related to pain. I'm not looking for a life story, but sometimes you get that. But yeah, patients will tell me what's the inciting event, if there was one, or if this is a chronic issue versus acute issue, and then I'll just listen. And then
Okay.
based on what they tell me, if they've had imaging studies done, I'll review the imaging studies with the patients and kind of correlate what they're telling me with their anatomical findings. And then if there's no imaging studies, it'll give me an idea of what I need to order to get more information.
Okay.
And then once we're done talking, I'll do a physical examination.
Okay.
And so that focuses on a musculoskeletal examination, focused
Okay.
on the area of the pain complaint, and sometimes a neurological evaluation if there's something
Okay.
a little more concerning going
Okay.
on. And then after I put this together, I usually explain to patients, I have an anatomy app I like to share.
Okay.
And so I'll show them, well, this is what I think is going on, or if they do
Wonderful.
have an MRI, I can show them exactly what's going on. And then we talk about treatment options.
Okay. And what are some of those treatment options that you provide for those patients?
So, you know, the emphasis of our practice is non-narcotic modalities. I
Absolutely,
believe there
yeah.
is a place for narcotics for chronic pain management, but our practice focuses on non-narcotic modalities. So that's the majority of our clientele and
Okay.
patients that we see. You
So
know,
people that just really want to focus on getting better and
Yeah.
healing themselves from the inside out.
correct, getting to the root cause of their issue
Okay.
and what they can do to heal themselves ideally.
Yeah.
You know, my vision is to empower people. I give you
Love it.
options, you know. So, for example, if you do have sciatic pain, well, here are your options. You know, you can take anti-inflammatories, muscle relaxers. I'm a big proponent of physical therapy and a team approach to managing people, because what I do is just one small part of it. And so I have a team of people I coordinate with. And so, you know, in addition to the medications, we do interventions. So
Okay.
cortisone shots for some people. Other people who may not be candidates for cortisone shots, we do regenerative medicine procedures for.
Okay.
So that's PRP, or platelet-rich plasma. It's kind of a big buzz in the medical world right now because it's showing some promise for reducing inflammation more naturally.
Wonderful.
And then possibly regenerating tissue.
Wonderful.
In certain cases, it's not for everyone, but for some people it may be a good option.
Okay.
And then in some cases, surgery is
Okay.
indicated. So
Okay.
I tell my patients, my goal is to keep the surgeons away from you.
Yes.
So
Okay.
we try everything we can before we have to go to that route.
Wonderful.
But those are more for the acute situations. For the chronic pain patients, a lot of it is just finding what they can do within their physical capacity to keep moving.
Okay.
You know, pain starts to limit you, and you become sedentary, and that
Right.
causes other diseases and health issues.
So you gave us a lot of great information, and I think really educated the audience and people out there who might be dealing with some of these symptoms of, you know, really what to look for and when they might need to come and see you. So thank you so much for
course.
all the information, and stay tuned for more videos.